critical and diagnostic thinking for better clinical judgment. We look at the definitions of critical thinking. It's purposeful, it's rational, and it sets out to accomplish specific goals. Its purpose is really goal-directed process of inquiry that uses available facts, principles, theories, and abstractions in order to analyze, make inferences, solve problems, and then arrive at decisions. Pearson's red is to recognize the symptoms, evaluate the arguments, and then draw conclusions. This is a skill the nurse must understand and incorporate into practice. To ensure that decision-making process will lead to the best possible patient outcomes, the need for critical thinking helps to decrease errors and sentinel events and to improve patient care systems. It is needed to give careful, complex consideration of what must be done and how best to do it, and it's needed to evaluate the nursing care. Types of reasoning embedded in critical thinking. When you look at reasoned thought, this is discriminating, prudent, and does not allow emotions, feelings, or prejudice to skew decisions. Nurses who practice reasoned thought recognize when negative factors may be interfering with their ability to think clearly. Clinical judgment. Perceptive understanding of a situation based on knowledge, empirical data. Now, empirical data is what can be observed or experienced. Clinical judgment decides whether to proceed with or revise a course of action. Critical thought is experience, knowledge, and skills required in order to think critically. This is a disciplined, rational, and self-directed activity that uses standards and criteria. Critical thought assists the nurse to make effective clinical decisions, and nurses who engage in critical thought will meet more of the patient's needs and affect positive patient outcomes. Related thinking skills. Diagnostic thinking. This is flexible and embraces complexity. This uses both analytical and intuitive cognitive processes. The characteristics are the ability to grasp and analyze the complexity of any given situation, uses all of the data at hand to make inferences and deductions. Cultivated thinking. This is engaging in critical thought, and is thought that is organized, enlightened, and educated. It doesn't assume that all pertinent information has been gathered yet seeks the latest and best information available to make the most appropriate decisions. An RN who continues to update the data and stay well informed will best meet the patient's needs. Deductive reasoning. Process of going from broad information to specific details or from general to specific. Deductive reasoning process is taking general assessment data, drawing conclusion, identifying the problems or needs, and formulating a plan of care. An example is the nursing process because it involves taking data and then deducing that plan of care. Inductive reasoning occurs when a patient presents with symptoms or problems the nurse has seen before. From the assessment data gathered, the nurse then makes inferences, which is conclusions or assumptions, then asks further questions and makes the decisions. The strength of the inference is based on the extent of the RN's knowledge and experience. It goes from specifics to generalities and infers the likely outcomes based on supporting data. After a nurse gathers data from the assessment and identifies needs, the nurse develops a plan of care. So the nurse is demonstrating which type of reasoning. The correct answer is 3, deductive. Elements of reasoning and critical thought. The purpose is to recognize that all thought has an agenda and ask the question, what are you trying to accomplish within the context of your thought process? The second element, the question at issue, defines the purpose clearly and accurately. Available information is based on data that's at hand and will give a greater understanding of the problem. Gathering historical and assessment data from the patient as well as seeking all available secondary source information. This assists the critical thinking nurse to support the plan of care and understand the potential outcomes. Interpretation and inferences. This is the conclusion that results from or a summary of the process. As the thought process develops, concepts form that begin to explain the problem at hand. These are ideas, theories, or mental images of something that does not yet have tangible representation. Assumptions. Assumptions are educated guesses. Hypothesis. Stated or unstated beliefs are accepted or held as truth without proof. Implications. Defined through outcomes, expected or unexpected. And then point of view. Explains or illustrates how the data can be understood from different positions. The structure of critical thought. Critical thought is fluid and circular. The critical thinking process assumes that questions are formed for each step of the nursing process, is asked and answered. Attributes of the critical thinker. This begins with curiosity, and it's a desire to understand what something is or how it works, to be compelled to explore beyond what is immediately obvious. May also imply skepticism or the needs to challenge beliefs in search of other possible conclusions or truth. To retain an open mind and to look freshly at the world and our patients, and to practice discovery every day. Curiosity does not prejudge. Reflection is looking back and reconsidering ideas, thoughts, beliefs, and actions, and helps the nurse improve practice through careful self-critique of prior scenarios. Diligent pursuit of evidence and information. This seeks the relevant evidence and information as part of the process of the decision-making. Collaborates with experts and consults other references while developing the plan of care. Rational thought. This is knowledge gained through study and experience, and it helps the nurse predict likely outcomes of planned actions or interventions, making sound clinical decisions based on all available information. Creativity. It's the ability to be innovative, resourceful, and inventive. Recognizes patterns that are present but understands that outcomes are often uncertain until tested. Intuitive thought. Involves one's sixth sense, their instinct, their insight. Intuition implies perceptiveness, the ability to see or sense subtle patterns or characteristics. Can be referred to as that gut feeling. The 6 critical questions. This is important to think about when someone has something to say. Who said it? What did they say? Where did they say it? When did they say it? Why did they say it? And how did they say it? A nurse wants to develop attributes of a critical thinker. Which attributes should the nurse practice? The correct answer is number 4. Reflection, creativity, and curiosity. The process of critical thought is rooted in discipline and is exemplified by being true to the standards of thought, testing one's thought process for clarity, accuracy, specificity, relevance, logic, consistency, depth, and significance. Individual RNs are responsible to develop critical thinking skills. One way to do a visual for critical thinking skills is by doing concept maps.